Excellent. Thank you for everybody's joining. I'm going to give it just a minute to let folks get from the waiting room into the meeting room. Looks like we have bunches and bunches of people that are joining us today, which is fantastic. Let me also share my screen if I can. All right. Welcome today to Mama's Voices Lunch and Learn for June. I'm happy that y'all are here. I am currently in Texas. My name is Nicole Purnell. It is hot here, though not as hot as it probably is where Keira is in the Midwest. Not having to deal with that heat bubble here. Surprisingly, it's cooler, but it's still not warm. It's still not cool here for my liking. So I'm not sure where folks are joining in today from. All right, if you can for us, it'd be really nice just to have people in the chat drop where you're from. It is helpful for us to kind of get an idea if you're with an organization or what state. Our funders love to see these kinds of things as well, and it just kind of helps us to keep track. So appreciate you all for joining in today. Let me get this in the right place to share it. Actually, what am I doing? What we've got today. Okay, so we've got Keira. Today I'm just gonna go into it and talk about our agenda for the day um, I'm gonna share a little bit about Mama's Voices, the program. I'm gonna introduce our speakers and then they're gonna talk about how to support NICU parents. So this is something that is so common in this space with different maternal health conditions. If you look at we've gotten to the point of looking upline and trying to like healthier moms will have healthier babies and not necessarily needing the NICU stay, but there's still always that need. And so how can we use this, and it's something that is more universal. It doesn't matter what necessarily condition you had, and sometimes you don't even have a maternal health condition and still have a baby in the NICU. So Mama's Voices, if you are unfamiliar with us, our mission is to amplify the voices of people who've experienced pregnancy and childbirth complications or loss, especially those who've been historically marginalized, ensuring they're equipped and activated as partners with providers and researchers to improve maternal health outcomes. Our vision is really that wherever there is a decision being made about moms, that there is a mama's voice included. So throughout this presentation, you may hear us say things like woman, mom, mama, mother, she. We're just going to use these throughout the presentation. We recognize that not everybody acknowledges themselves with this terminology, but to make it easier as far as presenting, you may hear those throughout. So just a disclosure for that piece. And Mama's Voices, we really have a couple different audiences. So today, Keira is going to talk about the NICU part of it. They are a Mama's Voices partner. They're part of our coalition as the NICU Parent Network. And so that's one of our different audiences. And we also have a lot of healthcare providers too that may be joining here as well and giving them an opportunity to learn and how to support their patients better. We have over 43 different organizations that are patient advocacy organizations, support organizations, community-based organizations that are part of our Mama's Voices Partner Coalition. And so if that's something you're interested in, just shoot me a message and we can get you connected with some information about that. One other little last tidbit to share is that we have recently launched our substance use disorder resource hub. There's a ton of great resources in there if you're looking for things that are trauma informed or about respectful care. Is really underlying in how those patients are treated. And it's something that can be universally applied to any patient as well. So make sure to check those things out, and we'll drop the link to that in the chat. And Keira, I'm going to turn it over to you and let you take over from here.
Thank you. Sorry. Let me just get to the right slide real quick. I thought I had it up, but I Had the wrong one there. Okay. Well, thank you so much for having me. This is really just such a joy to be in this space with other parents and advocates and people who just, care about babies and families. And I'm excited to share a little bit about what brought me to this space, and then a little bit about the NICU Parent Network and the work that we do. So I am a mom of triplets, and there was one day in February back in 2008 where it's actually standing alone um, in the middle of this chapel, and I was kind of lost in thought. I remember seeing the rays of the sun kind of come in through the window and bounce off the crystal drops of the chandeliers, and just kind of sprinkling rainbows all over the carpet. And I didn't even realize that the chapel director had entered. And I did look up, and he gave me a very warm smile and placed a hand on one shoulder, and then he handed me a container about the size of a pint of milk. And it was the urn that held the ashes of my 14-month-old daughter, Zoe. And this was the day of her memorial service. Zoe's life was far too short, and it began in a way that I wish no child had to enter the world. She and her triplet sisters, Avery and Lily, were born at just 25 weeks, 5 days. And Zoe was by far the sickest of the three. That's her in the upper left, Avery in the upper right, and then Lily down at the bottom. But Zoe's early months in particular were filled with medical procedures, ventilators, heel sticks, infections. And when she finally came home after 291 days in the NICU, she came home with hearing aids, an oxygen concentrator, a nasal cannula, and a G tube for nutrition. But this was Zoe, despite all of that. She smiled, she laughed, she rolled around on the floor and played Steal the Passy with Lily, who usually had two in her mouth and one on each pointer finger. This was her. She brought us joy beyond words, and she is deeply missed. But it wasn't always like that. In the beginning, I didn't feel connected to her or her sisters right away. And I now know that that is a trauma response to their emergency C-section birth, which was due to preeclampsia. But it was the gentle, patient guidance of our primary nurses where the love that I felt for them grew. And it was in one of the most unnatural places, the Neonatal Intensive Care Unit. But what happened there in that unit happened because that NICU team really embodied the core tenets of family-centered care, which are information sharing, participation, collaboration, dignity, and respect. As NICU parents, we are stripped of all of our natural parenting instincts. And having had a surprise full-term baby, Mia, 5 years ago, I now know just how much I missed with Avery and Lily and Zoe. In the NICU, I couldn't just scoop them up into my arms when they cried to comfort them. It took at least one nurse and a respiratory therapist just to place them on my chest for skin to skin care. I couldn't rock them in the privacy of my own home. I had to pull a curtain around me and schedule a time. And there were moments where I wondered if I could even be called a mother because I didn't know how to care for them and I didn't feel connected to them. But our NICU team helped me reclaim that role. They turned that unnatural place into a place where our love could grow and where we became parents in the truest sense. It's where our advocacy journey began without us even knowing it at the time. And within those walls of the NICU, I saw Zoe's personality bloom. She loved big sparkly earrings. And my mother-in-law always wore big sparkly earrings. In fact, the NICU team nicknamed her Jazzy Grandma, which we still call her today. But wouldn't you know that before long, we saw nurses and respiratory therapists and neonatal therapists and audiologists that they kind of traded in their understated earrings for bright earrings just so they could see Zoe smile. And her smile really could warm the coldest heart. But unfortunately, our experiences weren't always so supportive. The day Zoe died was a complete shock. She had recovered from flu and pneumonia the week before, or so we had thought, but we had to rush her back to the hospital in respiratory distress. It took them quite some time to stabilize her, but they did. And we were kind of settling into the PICU, and I was just thinking, okay, here we go again, another hospital stay, something that other moms who had kind of gone before me had prepared me for multiple hospital stays, especially in that first year after the NICU, when you have a baby who's so fragile. So, we were just kind of starting to get comfortable and going, okay, let's plan out the logistics for the week. But in the middle of the night, she started to decline. And so we were asked to leave her room and go to the waiting room so that they could intubate her. For 3 long hours, we sat alone on cold, hard plastic chairs in that empty waiting room. For 3 hours, no one came to update us. No one brought us a coffee or a blanket. When I would buzz the nurses station, they'd just say, they're still working on her. And we waited. Now, Zoe, when she was in the NICU, she was on a ventilator for about 3.5 months and self-extubated more times than I can count. So I know, and I knew then, that intubation doesn't take that long. Zoe died at 9 a.m. that Saturday morning after coding in front of us. It was the second time that we had witnessed this, and the doctor just quite simply asked, do you want us to keep working or do you want to hold her? And without discussion, we didn't step out to a conference room. We didn't, weigh any pros and cons. My husband and I both at the same time said, pardon me, we want to hold her. She had had enough, and we had to let her go. What I learned a few weeks later, after requesting all of her medical records, that during those 3 hours where we waited, Zoe coded 7 times, and we were never given the opportunity to tell them to stop. Now, admittedly, I am not a healthcare professional. I am not a doctor. I am not a nurse. And maybe 3 hours goes by in a blink when you're trying to save the life of a child. But the family, the parents, must never be forgotten. We cannot be stripped of the agency to make decisions that we deem best for our children. And my experience is not all that extraordinary. I am merely one of the millions of parents who have experiences related to pregnancy, birth, and parenting that have forever shaped the people we are and even our career paths, as mine did. So after Zoe passed and life began to kind of, I would say, stabilize to some degree. I mean, I did suffer with mental health issues for many years. There was a point where the shock and the numbness kind of began to wear off, and I had this intense feeling inside that I had to do something. So I was able to start getting involved in some local advocacy work. I was in Georgia at the time. And I realized there was this glaring gap in the voices around the healthcare decision-making tables. More often than not, I was one of maybe 2 or 3 other parents, and I would listen to these very highly educated, skilled, compassionate, passionate, well-intentioned healthcare professionals and other stakeholders. And I thought, where are the parents? How do you know if the guidelines you're developing or the educational materials you're writing or the policies that you're working on changing, how do you know if what you're doing is actually going to help if parents aren't a part of the conversation? So I, along with 5 other veteran NICU parents, started what was then called the Preemie Parent Alliance. We later changed the name to the NICU Parent Network because we wanted to make sure that all families with a NICU experience, no matter if that experience was due to a preterm birth or full-term birth, we wanted everybody to know that they were welcomed and included. And our purpose was twofold. First was to build a collaborative community of NICU parents who were leading nonprofits and small businesses, hospital programs, or they were authors, but all in some way were supporting other families. And, just about any profession, you will find a membership association. Before my advocacy work, I was a high-end residential interior designer, and there was the American Society of Interior Designers. And that's where I learned a lot. I connected with other people. You join these associations for professional development, for networking, for learning about new products or new codes, building codes, and that kind of thing. And so for us, there really wasn't anything like that. We call ourselves NICU parent leaders, and this is a role that you cannot get a degree in. It's a role that you grow into because of your lived experience. So from day one, we've always said that there is no single organization that can meet all the needs of all of the families that need support and do it well. But by working together, we can be much more effective. And this is not about an organization being the #1 support organization in the country. Our members believe it is only about the families and getting them the individualized support that they need from trusted, trained, and vetted organizations and leaders. Pardon me. So I'm just so proud to look at this slide today and to see that we have 43 organizations across 26 states who provide a combination of 28 individualized services. And each year, collectively, they're supporting one-on-one over 200,000 families. And that does not include social media followers. Those are the families that are having direct impact from these amazing organizations. So going back to the reasons we started, the second reason we started was we really wanted to create that collective voice for NICU parents, to make sure that that voice was represented in healthcare, from product development to research to education, guidelines, policy development, legislation. We want to make sure that the NICU family voice is represented appropriately and professionally, so that all of the work done by so many will be even more impactful and ultimately lead to better outcomes for the babies and their families. And it was in this spirit of elevating the NICU parent voice and giving families a voice that we created the NICU Babies Bill of Rights. It was one of our first collaborative projects all the way back in 2014. And we did this because every baby and every family deserves more than survival. They deserve a care system, practices, and policies that are family-centered and that actively affirm their presence, their love, their involvement, and their voice every single day. These 10 rights are simple. They are human, and they are most of all rooted in love. The right to be seen and held, the right to sleep, the right to hear familiar voices, the right to a care team that includes and integrates their parents, the right to be respected for who they are, including their culture, their story, and their beginnings. We've since revised the Bill of Rights twice, most recently in 2023, to keep up with changes and evolving science and language usage. And, while there's been progress, family-centered, trauma-informed care is still not the standard everywhere. But the evidence, all dating all the way back to around World War II, continues to reaffirm what we've known all along, that parents are not optional. And we are so excited that this little project that we started back in 2014 has begun to grow. So in March of this year, uh, Indiana Congresswoman Erin Huchin and Kentucky Congressman Morgan McGarvey, who is a preemie dad, introduced House Resolution 236 in support of a NICU baby's Bill of Rights. And this recognizes the critical importance of delivering that care that is family-centered and developmentally appropriate. It clearly communicates that parents are their baby's best advocates and must be respected as equal members of their baby's care team. My greatest wish is that all NICU families would have the NICU experience that we did, not the one that we had on Zoe's final day in the PICU. What our NICU did so well, as I said before, was they lived out the values of family-centered care, and that's what this resolution is all about. I think one of the most critical components of FCC is respect and dignity, because to me, everything else flows from respect. If you respect someone, you're going to collaborate with them. If you respect someone, you're going to share information with them. Our NICU team just always showed us that respect for our role as parents. We were involved in every care task that we could be. There was respect for the reality that the NICU stay was just the beginning. We were mentored to continue her care at home and the care for her sisters. There was respect for our ability to make decisions. We were consulted, we were heard, we were included. And there was respect that we were the central members of the care team. We are not extras in our baby's life. We are the leads. And this is the core driver behind the NICU Babies Bill of Rights and House Resolution 236. So I do have an ask of everybody today. Would love for you to know that we are heading to DC next month to advocate for support for House Resolution 236. And I would love for everyone here to scan that QR code and send a letter to your representatives supporting House Resolution 236. This is really our first big step as NICU Parent Network into legislative advocacy. But we've been advocates since we started back in 2012. One of the other ways that we have effectively partnered with healthcare professionals and other stakeholders to, again, elevate the voice of NICU families is through our position papers. And I'm so happy. Our board president, Jennifer Deagle, is here. I think I saw her name. Hopefully she'll be able to unmute and turn her video on. Jen is the founder of Speaking for Moms and Babies, among about 1,000 other titles that she wears, including author, teacher, advocate. She is a mom of 4, one of whom was a 23-weeker. And hopefully she's still here. I know she's a teacher, and there you are, in between, I think, grading finals for her high school students. So thank you, Jen, for popping on for a little bit. I just have to say, Jen has been really the force and the leader behind our Advocacy and Policy Committee, and has always led the way with our position papers, the Bill of Rights revisions. So before I have her go over the kind of the highlights of the papers, I do want to point out kind of the difference between a position paper and a clinical guideline, because they are a little bit different. So a position paper, which I'm sure many of you have already read position papers, I'm sure you've all written position papers, but so you know that it's basically a consensus statement to address a problem. It's not going to give detailed guidelines for practice so that it can be implemented across the board, no matter where you are regionally, no matter what the technology is that you have or don't have, or what the local practice might be. So with that, I'm going to turn it over to Jen and just have her kind of go through the information about our first position paper, and then we'll talk about our most recent one as well.
Okay, thank you. Hi, everybody. Thank you for the opportunity to be included today for just a couple of minutes to walk you through some of the position papers that we've written. First, thank you, Keira, for your story. Every time I hear it, and I've known you for so many years now, it does bring tears to my eyes. And I did not know the story about the earrings So I'm really happy to have heard that today. So thank you for that. And in my classroom, if you see a strange background. Okay, just a very quick little bit about me. My daughter, her name is Joy. She was born at 23 weeks gestation back in 2012, and she was she was in the NICU for 121 days. She was born at 1 pound, 4 ounces. And during that time, as you can imagine, it was quite life-changing, which led me to the work that I do today, including what I do for the NICU Parent Network and how we collaborate. Okay, so you're looking at our very first position paper, which we were super excited about. So it's called the NICU Parent-Led Peer-to-Peer Support Services. And just to go back in time a little bit, before we decided to write a position paper, we did poll our membership and we asked them for things that they thought were the most important issues being a NICU parent at the time. And there was a few issues on there, but at the time, this was the number one. So this is why we chose to lead with this as our first position paper. And if you're looking at the cover there, you probably can see a little bit. That is my daughter, Joy, and my husband's hand through that little bit of white there when she was a couple of days old. So being a NICU parent, NICU parents are forced to experience the trauma of having their baby born either very early or very sick and not being able to bring them home. And that might be the experience for some of you, and you certainly heard about Keira's. Many of these times, the parents also experience a traumatic pregnancy that led to that birth, and even a really traumatic childbirth in the process. So NICU parents, all of them are really confused by the myriad of hospital policies and protocols at which they are exposed to. So being NICU parents who had experienced most of this, we really felt that peer support can help these parents navigate the hospital systems more effectively and really give them support of other parents who experience a similar journey. We fully recognize that no journey is the same, but the NICU itself is very similar. And if you have the opportunity to have a conversation or several conversations or be mentored by another parent that has had a baby in the NICU for any period of time, you will benefit from the understanding that it has happened to others, and you will benefit that, the feeling that you're not alone. So peer support can help the parents meet their baby's care needs more effectively, and also really give them some confidence and help them with their voice. So at the time, we really worked with all of our members and our leadership team and our advocacy and policy committee at the time. And we did a lot of research. We did actually a lot of research in the background to almost everything that was out there at the time on peer-to-peer services, including some, very important papers by Dr. Sue Hall and others that have written about the importance of having family peer-to-peer support. And we felt that every parent of every baby admitted to the nursery or the NICU, a special care nursery, should have that support from a veteran parent. The goal of the paper is really to show that the physicians, the nurses, the hospital management, that peer-to-peer support services should be offered to each parent once their baby is admitted to the hospital, no matter the circumstance. And our second goal is really to encourage the hospitals to take advantage of services and programs that already exist for parent support, or create a program if there's nothing that's already in existence. And we are always available to help with that. So it was it was really a wonderful experience to write this paper. We had great feedback about it to the point where we had already discussed trying to put together our second paper. And when that came around, we did a little bit differently. So we did pool our members again, and we did ask them what at that time, which was just a few years ago, was very important. And just coming out of the pandemic, you'll understand why our second position paper is what it is. But we had even these conversations before the pandemic. So our second paper, we didn't do it alone. We felt that we really wanted to collaborate with all the voices, every stakeholder that is from any side of any opportunity to care for any baby in the NICU. And by doing so, we really were able to show and get the opinions of everybody that's working with babies or has a baby in the NICU. So our second paper is called The Continuous and Uninterrupted Parental Presence in the NICU. And as I said, we had started talking about this before the pandemic, but based on a lot of the restrictions that came out of it as far as visitation time, we don't like to use that term, and other opportunities for parents to be with their babies being restricted, this really kind of came to our forefront. So this paper really came from the belief that the relationship and the bond between a parent and a newborn is unparalleled and essential to a baby's physical, cognitive, psychological development, and long-term well-being. And in this paper, we really advocate for all NICUs to consider parents as their baby's primary caregivers, and they are essential and equal and integral part of the care team. And like Keira mentioned before, they are not the extras. So the crux of the paper really discusses that from admission through discharge, that hospital policies and bedside care should encourage and support continuous and uninterrupted presence and participation of any parent and caregiver that wishes to be there. We advocate for the complete parent participation by promoting healthy relationships and increased bonding, supportive parent education, helping parents find their voice, and empower them to be more advocates to their baby's care, support for parental and caregiver mental health, and promoting true family-centered care. And when we set out to do this, we did, as I mentioned, partner with some very important stakeholders that their voices are invaluable to this conversation. And those include our partnership with members of the NIDCAP Federation International, the Family Centered Care Task Force, the National Perinatal Association, and the National Association of Neonatal Therapists. I think I'm saying that correctly. And all of them gave feedback and had their members and their leadership contribute to each section of our paper. And it was a wonderful experience because we are coming from the parent perspective, and having these other stakeholders and healthcare workers and clinicians participate in this, we really were able to hit this from every angle to clearly, bring forth our message that parents should be a part of every single decision being made in the NICU and beyond. So those are the two papers. As Keira mentioned before, this one was not published too long ago, but we would really like to ask you and encourage you to scan these and share them with your circle, share them with your members of your team, with families, legislators, anybody that you're working with that has the potential to improve the life of a NICU baby, an infant. We would really encourage you to scan our papers and share them out. And we're always available for questions and opportunities to discuss these two papers. Thank you for your time.
Thank you so much, Jen. Thanks for joining us. I hope you enjoyed grading the rest of those finals.
Yes.
This was the rest of the day, but also just want to say this, I'm just so proud to be able to work alongside Jen and have known her for a number of years now. She's just a vital member of our community. So thank you so much. As I kind of wrap up, I came across this quote that I really love. It says, "There's no power for change greater than a community discovering what it cares about." And I feel like that really speaks to not only what drives us individually, but also the power of community. And this is that kind of community. The NICU Parent Network community, the MoMMAs Voices community. We are not defined by our titles or our roles, but more by our shared purpose and our lived experience with one of the most precious and personal parts of life, pregnancy and parenthood. When our personal truths meet collective action, change we never could have imagined begins to take shape. I mean, never in a million years, when I sat in that first advocacy luncheon in Atlanta, Georgia, did I think that I would one day be advocating for a House resolution before Congress. So I do want to just close and say thank you all to every single one of you for the work that you've done and the work that you do every single day. As advocates, this work is not easy. This kind of work asks a lot of us, and it can be exhausting. Sometimes it can be disheartening. Sometimes it can be isolating. So I just want to remind all of us that showing up for families also means showing up for yourself with rest, with boundaries, and with community to lean on when we need it. So thank you so much for your time. This is my email, my cell phone number, and Jen's email, our website. If you have any questions, I'm happy to answer those now. If you think of some later, you can always email me, or actually texting me is better. Pardon me, I respond to text messages a lot faster than my email. Sometimes my email gives me anxiety. But anyway, thank you so much.
There we go. Thank you, Keira. And yes, I just wanted to help facilitate any questions. If anybody has anything, they can either drop it in the chat or come off mute and come on camera and ask as well. We're always open and welcome for those things as too. Let me see. I did get to see Kelly last week and Austin speaking.
Yeah,
I heard wonderful things about what they're doing down there in Austin.
Oh yeah. Yep. She also, I mentioned to her that I was doing this lunch and learn, and she said, "Oh my gosh, I met them. They're amazing. I heard them speak. I'm so happy that they're in this space."
Yes.
So yeah, anything I can answer. If you have any questions about the papers or the resolution, we would love your help getting the word out, so that we can hopefully see that get passed.
And can you share, y'all have a Hill Day coming up too,
We
right?
do. Yes.
Okay.
Yes.
When is that?
That is July 22nd and 23rd. Okay. So we did sell out. So we are at our capacity, but we do have, we've got folks, I think, from 33 different states coming. We have 8 former preemies themselves that are going to be there as well, which is super exciting. Yeah. And I think hopefully people have heard or saw that Colorado just became the first state to pass extended family leave specifically for NICU parents. And we've actually been contacted now by a congresswoman who wants to make that a federal thing. So we're super excited about that, because, I mean, the families can't be there. And so many of them can't because we have awful family leave. I mean, we have no family leave.